we're all set.
Alright, so I decided to do the project over bite wounds, and so before we get into like the medical side of like treatment for bite wounds, a lot of people kind of really don't realize that like it's accounts for about 10% of the traumatic injuries that veterinarians see, so it can actually cause a lot of anxiety in dogs, like lasting anxiety no matter what their age is, but especially if they're younger and they're kind of learning and kind of getting their like socialization period that we've talked about. It can kind of be like detrimental to make sure that these things go right. And so they may act timid or even aggressive, like right after the fight, and maybe even act aggressive towards you if they still are a little shooken up about it. So this is just a little diagram right here that shows some of the body postures and things that you can look for to see if your dog is kind of still uncomfortable around other dogs if it's been bitten. And so just to be mindful of that. It may need social rehabilitation afterwards. And in that process, you want to make sure you use positive reinforcement only. The bite was enough negative reinforcement for the dog. You don't need any more. So positive reinforcement is what's going to help it go fastest, and just taking it really slow. You don't want to rush the dog because that's just going to put you back at square one. But it can be done. Obviously, Arlo got the bite, and I mean, he does okay with most dogs. I think he was just kind of shocked at how big she was. He's never seen a big dog like that before. So then, why are bite wounds different than other types of wounds? Just the structure of them is a lot different. They're really deep punctures, so they're going to bleed more intensely and for a lot longer, especially if they're in really vascular areas, so like around the neck or on the ears or the face, things like that. Those are going to have some heavy blood. And since it's such a deep wound, infection can lie really deep within the wound down here, so it's going to need really thorough and frequent cleaning, more so than a normal wound would. And a good thing and a bad thing about them is they have a really small diameter. So this part right here, it's not really open wide, it's just open down, so it can heal up relatively quickly, but you want to make sure that there's no infection left down in the bottom of the wound, because you don't want this to heal over any bacteria, because that's definitely not good. And it can cause really intense muscle soreness and damage or more so than a normal wound, because it does penetrate all the way down and damage the muscle itself. And another big thing is it can cause really direct spread of diseases due to saliva. So like MRSA, if you've ever heard of MRSA, is a pretty serious one that can get transmitted to people. And then rabies, you don't see it a lot, but it's just a direct spread. And so treatments for bite wounds, if you are bitten, you need to wash it thoroughly with antibacterial soap and apply some antibiotic cream and cover with a bandage if it's a minor wound, and then you'll just monitor it until it's fully closed. Usually the minor wounds will heal pretty quickly, but with severe wounds, you actually want to allow some bleeding to happen, because the deeper the wound is, a lot more infection is going to be in there, and when it bleeds, the blood is going to draw out a lot of that bacteria, so you actually want to let it bleed just for a little while to try and get rid of all the germs that could have been in the dog's saliva, and then you'll want to apply pressure until the bleeding kind of slows. It's not really going to slow for a little while, because I've been bit by a dog before, and it didn't really fully stop bleeding until like the day after, so just depending on how deep it is. And you're not really supposed to use hydrogen peroxide, at least not too much, because this is actually going to damage the tissues deep in the wound, and it's going to kill all the good healing bacteria as well as the harmful bacteria. So if that's all you have, it's fine to use, just use it really, really sparingly. It's better to just use an antibacterial soap and then the antibiotic cream, and you cover it, but leave it uncovered every so often so that it can breathe. Since it's so deep, it's going to need that. And you definitely need to see a doctor if you didn't know the dog, because you don't know its medical history and what it might have come in contact with. And if you haven't observed very much healing after a couple days, you should probably go ahead and go in, because even serious bite wounds should show progress of healing after a couple days. And then treatment for a bite wound if your dog is bitten is kind of a different story, because they have so much fur that you can't really see the severity of the wound. And you shouldn't just like shave it at home, because it's not guaranteed that all that is sterile, and you're probably just going to get more bacteria into the wound. And the dog can't really tell you how he's feeling. It's hard to see the skin around it to make sure that it's not pink and inflamed and infected. So it's just better to take them to the veterinarian for any type of bite, minor or severe. This is a really good example of a minor bite right here. Not too much inflammation. The bleeding has stopped. This was on the dog's back. But this one is near its neck, and you can see right down into the wound. It's really deep, it's definitely still leaking, really red and inflamed, so that would be kind of considered a more severe one. And then some more serious bite wounds or lacerations may require a drain. And a drain is just designed to remove unwanted fluid from a wound or a body cavity. So if it's a pretty serious bite wound or like laceration like this, it will need sutures. Most of them don't need it because they have such a small diameter. It'll close up on its own as long as it's cleaned. But this was pretty serious, so it needed sutures. And that's why it's got the drain, because none of that liquid or that unwanted fluid or pus or anything can get out now, so that's why the drain is there. And so really with home monitoring and just like home care for that, if a veterinarian does give that to your dog, you just need to monitor the area around the drain insertion site, and that can be cleaned with hydrogen peroxide. It's just on the surface to just keep it clean. And the drain should probably be ready to be removed after 3 to 4 days, but obviously it depends on the severity of the bite. And then also just limiting activity so as not to disturb the sutures or the drain insertion site, because those things can be really sensitive. And that's pretty much it.
And that's your source?
Mm-hmm.
Yeah, you made a good point about if you ever get bit by a dog, you better know if it was vaccinated for rabies or not, because that's,
Better be safe than sorry.
oh yeah, you gotta be safe. In Australia, are they rabies free? What's the story on that? I thought at one time they were rabies free, but I'm not sure.
No.
Did I put you on the spot?
No.
That's okay.
I think that do have rabies.
Okay, okay. Because I thought there was some island countries tend to be rabies free. I can't remember if Britain is or maybe Australia was at one time. I don't know. So.
Yeah, it's free.
Okay, it's free. Okay,
Yeah,
yeah.
just kind of.
He just was pulling my leg a little bit. Okay, yeah, yeah. And so my question is, I wonder if they vaccinate anything for rabies in Australia, like the dogs. I don't know. Maybe Kenny there will tell us. I'm not sure, but obviously in the United States we have to vaccinate. There are, especially if you travel around the world, if you ever get bit in another country, make sure you tell the authorities and they make sure the dog is vaccinated. Because in some countries there's not a lot of vaccinated dogs. The wild dogs are, they're running around the street, they're not vaccinated. And then if you ever do get bit and you have to go through the rabies shots, there's different protocols to do depending on circumstances. But it's nothing to fool with because it is basically 100% lethal. If you do develop the clinical signs of rabies, you're basically gone.
And if the dog did have rabies, someone needs to know about it. So
Well, right. I mean, it's very rare in the United States relatively.